All right, so Dan, I'm going to go ahead and turn it over to you. Looking forward to your presentation.
Perfect. Thank you, Lindsay. And thank you guys for attending this. I think this is going to be a really good, hopeful presentation for you guys and anybody who's interested in physical therapy. Can I get a show of hands? And you guys can just do the hand, what is it, the hand, like raise hand. How many people have actually heard of physical therapy or have gone to a physical therapist before in the past? Okay. Oh, wow. That's a good amount of people there. So that's good. I think the people who have, yeah, you too, Lindsay. I think the people who have, raised their hand, obviously you guys are aware of what a physical therapist is and what a physical therapist does. I think today for the people who didn't raise their hand, hopefully this presentation will shed some light on what the profession is all about, some ways that you can, if you're interested, look into physical therapy a little bit more as a profession. I know there's other healthcare professionals that are talking, but today we're really going to focus on physical therapy. You guys, I'll give you a little background information on myself. I have a little video that shows our clinic and kind of the clinic flow and what it's like to be in our facility. And then we'll go through some different things, how physical therapy got started, what different settings you can work in, and that type of stuff. Okay, so let me share my screen here. Let's see. Okay. So we got that. I do have a little activity that we're going to do periodically at different intervals throughout the presentation. So I know a lot of you guys have your videos off, which is completely fine. The first little activity that we're going to do, everyone can participate. You don't necessarily need to have your cameras on, but I want everyone, and I don't know how long all of us have been sitting. I've been sitting for a little while, so we're all gonna stand up first. And if you guys can you guys still see me? Yeah, okay, good. So what you're gonna do, and I'm gonna try to show this to you guys as best as I can. You're gonna stand up and everyone's gonna have their legs pretty straight and you're gonna try to touch your toes. So you're just gonna bend down and then try to touch your toes there, okay? Some of you are probably a lot more flexible than others. Some might be able to get to their knees. Some may be able to get halfway down their shins. Some may be able to touch their ground, okay? So wherever you are at, go ahead, reach down and see how far you can go down and make a little note of that. Am I hitting my knee, my mid shin, my shoelaces? Can I put my palms flat on the floor? Okay, you got it? Everyone got that? You got your little mark? Okay, so now what we're gonna do is you're gonna do 20 squats, and squats kind of look like this. So you're just gonna go up and down 20 times really fast, okay? So let's go ahead and do 20 of those. We're gonna get moving. We're gonna get moving today, okay? So 20 squats, pretty quick, up and down. Feel the front of the thighs working there. There's a method to my madness here. So after 20, Lindsay's pumping them out. Marley, I see you too. You're going. Okay, so after 20, immediately you're going to go down and then try to touch your toes again. What do we think? Did we get further on that touch? Further or no further? Give me a thumbs up if you went further. Give me a thumbs down if you didn't go further. Okay, I got a couple thumbs up. I see a couple thumbs up there. Okay, good. So that's a little neurological principle that we use in physical therapy. When you go down to bend to touch your toes and your hamstrings are really tight, they're going to fight against that movement, so you're not going to be able to go down very far. If you squat, you're working your quad muscle. So when you work your quad muscle, you actually relax your hamstring muscle. So then it allows you to go down a little bit further. So that's just one little principle that we use in physical therapy. Kind of a cool little trick that you guys can use too with people. Okay, so what is physical therapy? That's going to be the topic of today. We're going to go through a little background information on myself. Let me start the slideshow here. Okay, so a little bit about me and my background. I'm a physical therapist, like Lindsay said, at Results Physical Therapy and Training Center here in Sacramento. You know, I was a high school athlete. I played basketball in college and high school. My junior year, so probably somewhere, are we seniors? Are we juniors? What? All over the map, freshmen everywhere? Okay. So I was playing, it was our first game of junior year of our high school soccer season. I fractured my ankle pretty bad. So the ambulance had to come on the field and tow me off, and went to the hospital, and I had surgery the next day, broke a couple bones, tore ligaments, all that stuff. So before that point in my life, I didn't necessarily know what I was going to do, maybe like many of you. And that one singular event kind of shifted me a little bit more towards physical therapy. I went through the whole process of rehabbing my ankle and trying to get back to sport and that stuff. And luckily, I was able to, worked with a pretty good physical therapist, and gave me hope, gave me some things to work on, and helped me guide me through the process. So then I went to San Francisco State University, and I played basketball there. Kind of gave up with soccer. I said, got injured in soccer. I don't want to do that anymore. So then I shifted all my focus to basketball. Played basketball at San Francisco State University. Actually did 2 years of junior college at Solano University, or Solano Junior College in Fairfield, and then transferred to San Francisco State and played there. From there, you do need to go to graduate school to become a physical therapist. So that's where I went to Sacramento State. Athletes Performance was a big training facility, and they train a lot of athletes. They have some physical therapists there. They have some massage therapists, kind of the whole gamut. So that's where I did the majority of my training. And then I moved back to Sacramento and started working with Kyle Yamashiro and Results Physical Therapy about 10 years ago. So I've been treating for about 10 years. Through that time, a lot of different experiences. Down here, these little certifications are just things that really help a sports physical therapist understand movement, exercise, science, and all that stuff. I did have a little ebook that came out on squatting and helping correct some of the movement deviations. And we're going to get into that a little bit further in the presentation, as far as looking at a squat and what we're looking for, and how we can change people's movement there. Like we talked about earlier in the presentation, or right before we started, guys, if you have any questions, feel free to raise a hand, jot something down in the chat. We can answer those questions as we go. There'll also be a little bit of time at the end for more questions. Okay, and then as far as Results Physical Therapy, if you guys haven't heard of us, we do a lot of the major sports affiliates in the region. So we're the physical therapists for all the athletics within Sacramento State. So the rowers, the gymnasts, the football team, basketball team, anyone who's dealing with an injury, we see those athletes, and we work with the athletic training staff over there. We do a sports medicine conference with the San Francisco Giants and work really closely with their team physician, their team doctor. The Sacramento Republic FC, so everyone knows about the Republic FC, a football or a soccer team here in Sacramento. We do their strength and conditioning and their physical therapy for their entire team. And then two things that are relatively new over the last couple of years, and this is where I just came from right now, rushing back into the clinic. Sacramento Fire and Sacramento Metro Fire are two fire departments in our region. They have about 1,000 firefighters between all of them, so we're their medical provider as well as far as physical therapy. I go out to the stations every week and help those guys out. Sacramento Running Association has some elite Olympian runners, Olympic qualifying runners, and we do all their physical therapy and their strength and conditioning as well. And the Sacramento River Cats, we kind of help assist when those guys are out on the road. So that's our facility in a nutshell. There's a couple other affiliations with high schools and local colleges too, but those are can only fit so many on the page here. So what I want to do now, this is a little video. It's going to show you guys kind of what our clinic looks like, some of the different things that we do. It's a promotional video. So we'll go ahead and watch this for a few minutes, and then we'll move on to the next slide.
Results Physical Therapy and Sports Institute is a very unique facility in that we do provide the highest quality of physical therapy, rehabilitation, as well as state-of-the-art strength and conditioning principles for performance training.
You feel a great vibe as soon as you walk in the front door. You see the state-of-the-art facility. You see all the stuff that's going on from performance training to physical therapy. And as soon as you walk in the door, you feel that energy.
You always feel when you step in the store, you feel like you're a part of the Results family. It really does feel like a family. The whole staff try to get to know you, make an effort to get to know you, even if you're not a patient of a therapist. They're always there to help and point out if anything needs to be corrected in exercises.
Our performance training staff brings the energy to their clients so that they're motivated to do their best.
We have a great coaching staff that has a keen eye for coaching, and we know how to progress and regress athletes and set them up for success.
Their staff is always wanting to be innovative and always cutting edge. They're always trying to improve themselves in order to improve their patients.
So we have a saying here that successful results are determined by the quality of effort. So here at Results, our staff will bring you their highest quality in order to take them to the very best.
So kind of a cool little video. And, you know, for those of you who have not been to physical therapy before, hopefully that gives you a little insight. Not every physical therapy clinic looks like that. And that's only one specific setting of physical therapy. That's something that we'll talk about in other slides. But hopefully that gives you a little bit of sense for what the facility looks like, some of the different things that we may do within physical therapy. So again, with our clinic here in Sacramento, we have 4 clinics throughout Sacramento. We have 12 physical therapists, an athletic trainer, a lot of different skills coaches. So you saw the guy throwing the baseball and you saw some of the performance training guys. So they help us out during that part of rehab where a person is going right back to sport. We see about 2,200 visits a month in one clinic. So that's 22, probably somewhere around 1,800 to 1,500 patients per month. Specialized treatment approach, which has made us successful in the Sacramento region. And these sports here are kind of like our prime sports that we see as far as rehabbing people back from injury. We do have a performance training side too. So we have 2 strength coaches and different programs that they run, but they really help us integrate physical therapy into performance training and then returning that athlete or that person back to their sport or activity of choice. So again, today is all about you guys and really learning about the profession of physical therapy. Again, if you have any questions, just go ahead and throw them in the chat and Lindsay will look at those for us. But we're gonna talk about what physical therapy is, the history of physical therapy, the different settings that you can work in. What is sports medicine physical therapy? How's that different than other settings? And then we'll do some more demos and assessments of treatments and get you guys moving a little bit more, okay? So a physical therapist is, in this setting, in the sports setting, it is a member of the whole sports medicine team. And in the team, you have the physician, athletic trainer, the PT right there, a strength and conditioning coach, a performance coach, a nutritionist, massage therapist. There's a lot of different people that really help guide a injured athlete back to their sport. And physical therapists handle the majority of that rehab in a one-on-one setting with that person. So we can see somebody 1 time a week, 2 times a week, sometimes 3 times a week for several months in order to rehab them and get them back to their sport or activity of choice. Physical therapy, so this is the definition right from our governing board. Physical therapists are healthcare professionals who diagnose and treat individuals of all ages, from newborns to the very oldest, who have the medical problems or other health-related conditions that limit their abilities to move and perform functional activities of daily life. So a functional activity of daily life is, you know, getting up, being able to wash dishes, being able to sit on the toilet, being able to wash yourself, walk around the block, get in and out of your car, up and down stairs. So those are daily activities that physical therapists really help people get back to doing. So that's a global picture of what physical therapists do. The history of physical therapy started way back in World War I. So our profession is well over 100 years old now. But the first physical therapists were all females, all women. There were no male physical therapists. And this had to do during World War I, all the males were out fighting the war. So all the women were at home. And when the injured males were overseas, they got hurt or they're fighting on our ground, they got sent back home. And these individuals, you know, they lost limbs. They were really injured very badly. And the women physical therapists really helped rehab these people back to being able to do normal daily activities on their own, so they didn't need any help. So they're all females at that point. Polio hit, and polio is a virus that really affects your nervous system, and the nerves innervate all your muscles. So polio can affect the ability for you to even raise your arm. It makes you very weak. So physical therapists were needed to help get people's strength back after bouts of polio. In 1921, the American Women's Physical Therapeutic Association was formed. So this was the first time that an association was formed. And again, it was still all females. Males did not start coming into the profession until 1922, so 1 year after that. World War II hit, and then again, they needed more physical therapists. So in World War I, there was only 200 physical therapists throughout the country. World War II, it bumped up to about 800, so still a very small number. And today we're well over 80,000 physical therapists throughout the country here. The American Physical Therapy Association started in 1946, and that's still our governing board. So that's still the association that helps fight for physical therapists' rights and to push our profession forward. Social Security Act in 1967 started, and that's where outpatient physical therapy started. And our clinic here at Results is considered an outpatient facility. It's not in a hospital setting. So that's when outpatient therapy started. We really started focusing on pain. So people who had pain came in, hey, I have pain in my wrist, what do? We worked on just icing it and calming down the symptoms, and that's what physical therapy was back in the 70s and 80s. In the 90s, we started looking at just single joints. So that's where a lot of the strengthening, a lot of the stretching, my wrist hurts, okay, let's get it stronger, let's stretch it out. And now the current philosophy of physical therapists is looking at the whole body, right? So even if your knee hurts, well, let's look at your hip, let's look at your ankle. How does that affect your knee pain? And we'll talk about some of that in future slides. So physical therapists assess functional movement. You can see in this picture down here that has the B and C on there, we're looking at somebody's squat. And again, that's something that we're gonna do today with all of us. If somebody squats and their knees cave in like that, that can put a lot of pressure on your knees. And over time, that can make your knees very sore. And there's multiple reasons why that may happen. You can have weak hips, you can have tight ankles, you can have a poor core control. So physical therapists really work to break down the different movements out of one big global movement and see what exercises are going to help you the most, what stretches are going to help you the most, education on what to avoid while your knee is hurting. We use different modalities. This is an E-stim unit that helps stimulate your muscle and turn your muscle on. We need to be able to identify big injuries like the one that we see in this x-ray down here. And that circle, that is a fracture in the foot. And this was one of my patients. She was a big runner, and she was actually coming in for knee pain on the opposite side. And the one day she said, oh, my foot hurts. So, okay, let's check out your foot. And after poking around and doing some tests, I sent her back to her doctor. She got x-rays and she had a broken bone in her foot. So a physical therapist needs to identify these type of things in order to make sure someone's still not walking around, and maybe the bone wouldn't heal properly if she didn't give it adequate time to rest. So there are a lot of different settings in physical therapy, and a setting is just a different type of physical therapy location. You can work in a hospital. So this is where people go in and they have some type of procedure. Maybe they need help getting in and out of the bed. Maybe they need help just getting up and walking around the hospital. A lot of the times to get out of the hospital, you need to make sure that your bowel and bladder movements are going. So a physical therapist helps get people out and moving and help with that process. Private practice facilities such as ourselves here in Sacramento at Results. If you get injured, let's say you sprain your ankle, you can go to your primary care physician. They say, okay, try physical therapy, and you go to a facility that's an outpatient facility such as ours. Home health. So home health is something where maybe we have somebody who just had a knee replacement surgery and they have to go home after having the procedure, but they're not quite ready to go to the outpatient facility yet. They need to stay in their home because they're not very mobile. So the physical therapist can go to your home, help you work on your mobility around your house, make sure you're safe doing all the daily activities around your house. And then once they're at adequate health level, then they can go to an outpatient facility. Schools, there's a lot of physical therapists now in schools. So physical therapists are now working in colleges, they're working in high schools. They're helping out not only with athletic teams, but even the students around the facilities. Sports, there's a lot of physical therapists in sports now. The Sacramento Kings have 3 physical therapists, and there's usually at least 2 physical therapists on every NBA team that you see. Like we talked about, the Sacramento Republic FC, we have a physical therapist that goes out there. And now different things like these first responders are starting to hire physical therapists within their departments. So firefighters, paramedics, those type of people are starting to have physical therapists being hired by their departments to help keep people safe and injury free. Nursing homes. So for folks that are getting a little bit older in age, maybe up in their 70s, 80s, and 90s, and they can't live at home anymore because they're not as mobile. They still need physical therapists to help them get up and exercise and make sure their muscles stay as strong as possible to keep them as functional as possible. And different work facilities, like we talked about, even SMUD. SMUD now has a physical therapist that works on site for SMUD and helps people with exercise programs, helps people set up their workstations to make sure they don't get neck pain or back pain when they're sitting. So there's a lot of different options within physical therapy, a lot of different settings that you can work in. And each one of these settings, it's almost like a completely different profession. So it's very hard for a sports physical therapist to go and work at a nursing home. It's very hard for someone who works at a school to go and work in a hospital. It does take a significant amount of training to be able to practice in that specific location. With that, there are specialties within physical therapy. So cardiopulmonary, after people have a heart attack or they have a heart procedure and they're resting in the hospital, there's physical therapists that help make sure their lungs are working correctly and make sure they're able to cough and drink and that type of stuff. There's neurological specialties. So after someone has a stroke or they have polio or they have some of these other neurological disorders and need physical therapists to help them function. Wound care. So if you get a big wound, there's actually physical therapists that help clean out that wound and do things so the wound closes and heals. Pediatrics. So pediatrics are really, really small people. So physical therapists can work with young people who are 6 months old all the way up to about 6 years old. That's considered pediatrics. So if someone is unable to crawl or if a kid isn't walking by a certain age, a physical therapist can help work with that kid in order to make sure they're hitting their developmental goals. Women's health is another specialty. So any women's health related issues, a physical therapist can help with that. Geriatrics are those older population folks. So maybe people who are in the nursing home. Orthopedics are general injuries like broken bones, falling and fracturing something, or having just general pain. Orthopedics help with that. And sports, which sports physical therapy is more just familiar with sports related injuries. Can I get a raise of hands and you could just hit the button? How many people have had sports related injuries or running related injuries, anything like that? I see a couple people there. Yeah. So that's kind of like our niche here with results. We treat these more sports related type of injuries, such as big injuries like ACL tears, rotator cuff tears, shoulder labrum tears, ankle sprains, UCL baseball players, they injure their elbows a lot. It's called a UCL injury. And some overuse injuries where you just have jumper's knee, which is kind of some pain around your tendon in your knee and the Achilles tendonitis. I'm going to take us out of this presentation really quick here. And then I have this app to show you guys a little bit more about the body. So let me open this up. So this is the app that we use to help people understand their injuries a little bit more. So it's a really cool app, and we'll look at the shoulder up here first. So if we can zoom in here, these are all the different bones. So a physical therapist needs to know all the bony landmarks here. So this is a ball that kind of fits in the socket, and that's the shoulder joint there. The labrum is a little rim that goes around the socket part of the joint. So if you have a hyperextended shoulder, sometimes that labrum can get torn, needing surgery, and that's where a physical therapist will help rehab that person back. These little bony landmarks here, these are where your rotator cuff muscles insert. So if we start to add some of these muscles, and it's a pretty cool app because you can kind of see all the muscles and layers. It goes from deep layer to superficial layer. So this is one of your rotator cuff muscles on the inside, kind of underneath your shoulder blade there. And then we can see what kind of motion this does. So it kind of helps internally rotate. Let's see if I can get there we go. It helps internally rotate your arm. So if you take your arm, you just kind of rotate it in like that. That's what that rotator cuff muscle helps out with. Okay, we go back.
What's the name of the app, Dan?
This is, I think it's called Complete Anatomy. Complete Anatomy. There is a subscription for this, but you can definitely find free apps on anatomy too. If we rotate around to the back side of the shoulder, these are the tricep muscles. So these help kind of extend your elbow like that. But again, a physical therapist needs to know, hey, I'm having pain on the back side of my arm. Okay, is that more coming from your shoulder? It could be coming from your neck. It could be coming from your triceps. So there's different tests that we do to try to differentiate. These muscles right here on the back of your shoulder blade that you all can kind of touch. You see that white bone right there? That's the back of your shoulder blade. So you can feel that bone. And if you come right up above that, this is called the supraspinatus muscle. So this muscle comes all the way over the top of your shoulder blade and inserts like on the side of your shoulder there. This helps lift your arm out to the side like that. So sometimes when there's little tears in the tendon there, and you guys can see the motion, when there's little tears in the tendon, then that muscle is not going to function very well. So it helps lift the arm overhead. If you have a tear in that muscle, you're not going to be able to lift your arm overhead. So people tend to try to lift their arm like this, and they can't really lift it. Well, that can be because of a tear in the rotator cuff muscle there. So there's two other rotator cuff muscles, and they're also on the back of the shoulder, but they're just below that bone there. And these two muscles really help rotate the arm outward like that. So we can see the motion here. It's called lateral rotation or external rotation, and really just rotating the arm out to the side like that. So sometimes if people can't reach out to the side, it's because that rotator cuff muscle can be damaged to some extent. Okay. A rotator cuff injury is usually due to a trauma. So your arm gets pulled, or you throw and your arm gets overextended in one direction, and it can cause a tear in that muscle. So if we get out of here, zoom back out, a physical therapist does need to know where all of these muscles are located. They need to know where all the ligaments are located, and ligaments kind of surround a joint to keep it very stable. As we start adding a couple more layers on here, you guys can see now that some of the bicep muscles start to come into play. In the front of the thigh here, these are your quad muscles, and those are the muscles that we're working when we were doing those squats kind of up and down. So they work to extend the knee. So when you go down, you bend the knee, come back up, extend it. That's where you work those quad muscles. These muscles on the back side of the thigh, those are your hamstring muscles. And when those are really tight, they're not going to allow you to touch your toes, right? So those are the ones, if you guys weren't able to touch your toes, we need to do a lot of stretching of those hamstring muscles. And then we add a couple more layers onto here. You can see the bicep muscle right there. And then we get like the pec muscles and deltoid muscles and all that stuff. But this is kind of what a physical therapist specializes in: anatomy, biomechanics, what muscles are doing what during which movements. So if you raise your arm overhead, we know the rotator cuff is really active. When you go down into that squat, your hip and your quads are really active. So a physical therapist needs to know that in order to give you guys the right exercises to rehab whatever injury you're rehabbing from. Okay, let me get out of this app here. But yeah, it's a pretty cool app, and we do a lot of education with our patients about their bodies with that app. Seeing is always a little bit better than just talking about it. Okay, so moving on, next slide. So when you come in to see a physical therapist, they're going to assess your movement. Some of these different movements here are different things that will take a patient through. Even if you're coming in with knee pain, we want to see you do a bunch of different things in order to tease out what may be causing that knee pain. Because a lot of the times the knee is not the reason why there's pain in the knee. It's usually coming from your hip, your core, or your ankle. So we got to kind of tease all these things out. So I think in another slide here, we're gonna practice one of those overhead squats and see what everyone looks like here. So during a physical therapy session, we'll do an evaluation of movement. We'll talk about the injury. How did you get injured? What did it feel like? Did you hear a pop? Did you just feel a muscle tighten up? How long did it last? Did it last a couple of days? Did it last a couple of weeks? Are you still in pain? We'll also do range of motion tests. And range of motion is just looking at how each joint moves, right? So we'll do a global movement test, like a squat, which we're going to do in a few minutes here. And then we'll look at each joint and see how that each joint is moved. It's very similar to a mechanic that works on a car. So you bring your car in for some type of issue. Maybe it's making a wobbly sound, or you go to turn the wheel and it's not turning very, very easily. Well, a mechanic is going to go in there and kind of look at the tires. They're going to look at the engine. They're going to check the oil. They're going to look at the steering wheel. Has the steering wheel moving? So a physical therapist is very similar in that regard, and that we're going to look at each part of your body and see what's going on. And that's going to allow us to give you the proper stretches and strengthening exercises, or just education on what you should or should not be doing at that time. I have some examples of some treatment, but this is an assessment here, and this is similar to what you guys did, a little toe touch. So we can see the back is kind of bending in that direction. I'll slow it down a little bit. When she arches back like this, what we're really looking for is, does her hips move forward over her toes? Does she have a nice curve in her lower back all the way up through her upper back? And you guys can see she's curving a lot at her lower back, but her upper back is looking a little stiff there. Her arms aren't really going behind her ears. So there's something going on with her upper thoracic spine or her arms there. So then if we go a little bit more and she comes back, and you can see she's just kind of really curved at her lower back. And I'll let you guys guess what type of pain she's having. So then we look at her from the front, and then she rotates. Her hips don't really rotate when she rotates. Again, she looks like she's just rotating through her lower back. She side bends really well. That's not a problem at all. And that's like a quick little assessment. So if someone comes in with neck pain, knee pain, ankle pain, whatever pain, we want to take a look at everything that's going on, because she had back pain, but it's not because her back is stiff or anything. It's because her back's moving too much. So then we work on the segments above and below to try to loosen those up. So this is a test that we're going to do here together. This is an overhead squat test. And you can see she's going to go down again. We'll slow this down a little bit. As she squats down, we want her feet to be forward or straight. Do her feet look like they're aligned straight, or is one rotated out more than the other? Looks like her right foot is a little rotated out more than her left foot, right? And look, she's got a little pain look on her face right there too. So she's kind of going down to her end range of motion. So we're really looking at where her knees are lined up with her ankles and hips, how her feet are lined up. And all this kind of helps determine what type of exercises we're going to give somebody. So you look from the side here too, and you can see right here, even her arms are forward from her head. That stick should be directly over her head, but there's some tightness going on there. So she goes down here. She's going to go into a squat, and her knees look good, her hips look good, but you see she kind of breaks at that point. So the stick is staying overhead, and then she gets to this point, and then it starts to fall forward like that. That stick should remain over her head the entire time. So that's one kind of global movement that we'll look at. So let's have everyone stand up here. We don't need a stick for this, but what you're going to do is you're going to bring your hands like overhead like that, and then you're going to squat down as deep as you can go, and then see if you can keep your arms overhead. Do they fall forward? Do your knees cave in? Are your feet rotated out? Does it feel tight anywhere? Do you feel tightness in your lower back and your hips? Or do you just flop right down to the ground? Is that good? So you see her going, try that. Try to keep the arms overhead. Your hand should stay kind of over your head as you're doing those. Keep the elbows straight. A lot of the times, just like Lindsay here in the video, those arms are going to plop forward. Okay, and that kind of tells us a little something there. Okay, if you guys have anything next to you, if you have your shoes or you have socks or anything that you could put underneath your heels, try that same movement, but you're going to put something underneath your heels. Okay, so you're going to lift your foot up onto something, put the shoe or something directly underneath your heel, and then try that squat again. Try to put it on both heels. What this is going to do, it's going to elevate your heel. It's going to take your ankle range of motion out of it. So if you guys squat with your arms overhead and it's very difficult, then you put something underneath your heels and you squat again, and it's a lot easier. Well, that kind of leads us to more of your ankles. Are your ankles really stiff? And that's the reason why you can't reach that full squat motion. Okay. So again, these are just some of the things that we do when someone comes in and really trying to determine what the issue is. She may have knee pain or back pain, but her ankles may be super tight, which may be causing her to lean forward more and put more pressure on her back. So if we just focused on her back, that might not help fix the problem. Okay, so this was a little test that we did with her. This is a upper back kind of flexibility test. So you can see as she rotates, she's not really rotating up very well. We want to see about 45 degrees of rotation. 90 degrees would mean her elbow is actually right over her opposite shoulder. So she's not quite getting halfway there, and that's what we're looking for, 45 degrees, okay? So she's pretty stiff there. And we saw that when she was squatting down with the stick. That stick was jetting forward. So with her, we're not going to focus on her back pain. We're going to focus on increasing the flexibility of her upper back so that when she squats, she doesn't have back pain. She can use the flexibility in that upper back like she should have. Some of the other treatments that we do, this is called a GRASTON tool. So when a muscle is very tight, we can take this tool, it's a stainless steel tool, and we can loosen up muscles. So we go up and down the thigh, we look for the tight areas, and those tight areas kind of vibrate underneath that tool. And once we find it, then we can kind of work that area a little bit more specifically, loosen that up, so that somebody doesn't have that knee pain that they have. And knee pain can be caused by their quads being really tight. If we loosen up the quads, it relieves a lot of pressure on the knee. And then we have to figure out why the quad was tight in the first place. Maybe, it was COVID and no one did anything for a year and a half. Maybe runners didn't run for a year and a half, and all of a sudden they want to go and run 50 miles a week again. Well, the quads are going to get pretty tight if you haven't properly trained them before returning to that activity. Here's another technique that we use to increase flexibility, and this is cupping. Has anyone tried cupping? Yeah, a couple people are shaking their head. Does anyone like cupping? Nah. It's pretty uncomfortable. It feels like a big pull on your tissues. You guys can see here, we'll put it on the lower back and really try to loosen up the tissues on the lower back. You guys can see some of these cups on the right are red and some are just the normal skin color, right? So the cups that are turning bright red, those are areas that have really good blood flow already. So the blood is kind of sucking up really fast. Those other cups that really don't have that redness in there, it's usually due to poor blood flow. So those are the areas where we want to bring blood to those areas. We want blood to be there to bring oxygen and all the nutrients needed for healing tissue. So this is a really good, really effective way on bringing blood to the area, but also increasing flexibility. We can also stretch. So a mobility exercise is stretching the quad here. So this is a position that we put people in to really get an isolated stretch on the quad. And again, all this starts with a big movement, and then we break the movement down by doing specific tests, determining which areas are tight and trying to loosen those areas, which areas are weak and trying to strengthen those areas. Okay, here are some other things that we do. So strengthening, when people have tight hamstrings, maybe are weak hamstrings, these are some exercises to increase the strength of those hamstrings. So bridging on the ball like this really gets the glutes and the hamstrings going. This lunge here is a big glute and hamstring and quad strengthening exercise as well. So these are some of the exercises that we would prescribe. This is a really difficult exercise here where someone's lifting their leg up and the other leg has to stabilize. So it takes a lot of core stability, it takes a lot of hip strength and hamstring strength to do that. Then we progress them to agility. So our patient population, people are trying to get back to activity. They're trying to get back to sport. They're trying to go beyond the activities of daily living that we talked about earlier. So if we just strengthen people and got people mobile, but didn't really test their fast reaction speed, then they would go out and do their sport and potentially get injured again. So here's something that we can do. We have a cord on Luke here, and he's going against some resistance and fighting that resistance as he's coming back. As he gets good with that and solid and feels good, then we can start adding more reactivity to it. So he goes forward and pushes back really quick, and that's forward and pushes back really quick. So you can imagine as you're trying to guard somebody in a sport, you're playing soccer, you're going up to them and they're trying to cut the opposite direction. You need to be able to change directions really fast. So we got to make sure they're safe doing that before they go back to their sport. Then we get into more power producing movements like jumping. So now he's going to jump and land. And you see that little knee wiggle right there? And on his right side, he's better, but on his left side, he gets a little wiggle, a little off balance. So those are some of the things that we want to correct and make sure he's really solid on that, because jumping is directly correlated to cutting. So if you can't jump and land, you're not going to be able to cut very efficiently or safely. So here's another one here. He's going to jump straight up and then land. And again, see his knees. Now he's laying on 2 feet, so his knees are a little bit more stable. So that looks pretty good right there. Okay, so you guys have seen kind of, what we do in physical therapy, kind of a different assessment techniques that we use, treatment techniques. So at this point, a lot of information. What do you need to do to become a physical therapist? If you guys are grossed out by this picture, you're probably not going to be a physical therapist. We see a lot of stuff like this. This is a knee post-surgical ACL reconstruction, and they took that's her patellar tendon right there. So we'll see people within a week after knee surgery there. But really, to understand if this is a route that you want to go, you have to do observation hours. you have to reach out to local physical therapy clinics in your area, and you have to see if they're willing to have you come over and observe. Now, I know with our clinic with high school students that will allow them to come over for like 1 4-hour block. So you come over and kind of see how everything's going. You can interact with the physical therapist, see the patients come in, the different injuries, and just get the general flow and see if it's something that you're going to be interested in. With our college students, we have them actually do more like summer-long internships where they're here a couple times a week over the whole summer, so they get a better feel for it. You don't need to really decide until you're in your first couple of years of college, really, if you want to do physical therapy. So it gives you have some time to kind of observe and see if it's right for you. It's heavy in science and math classes, so if you guys don't like science and math, it's going to be a little bit difficult going to a physical therapy program. And do you like working with people? This is definitely a people profession. You're with people every single day, 10 hours, 8 hours throughout the day, depending on your schedule. It's constant interaction. So if you're a little bit more introverted, if you like to do more computer stuff or not really interact with people, it's going to be tough to be a really good physical therapist. Observation hours. So you need a lot of observation hours. Colleges want to see that you've been in the physical therapy clinic and you really know that this is something that you want to do. Undergraduate degrees in kinesiology now are taking about 4 to 5 years. So you got to think about that if you want to become a physical therapist. It's going to be a lot of schooling. You got to be okay with that. It's a long-term investment. Graduate school is going to be another 3 years. So you go to college, you get your undergraduate degree, you graduate, and then you have to apply for graduate school. Now, in order to become a physical therapist, you have to have your doctorate degree. So that's another 3 years on top of getting your bachelor's degree. Okay. So if you look at it, it's going to be 7 to 8 years. In the grand scheme of things, a lot of people are going to college for at least 4 or 5 years, and they're coming out and they don't really know what they want to do yet, which is completely fine. But then they start working, they have to come back and go to school again. So if you're really passionate and you do your observation hours, you're like, yes, this is definitely something I want to do, the 8 years is definitely worth it. And then you have to pass a national license exam. So you go to school, you graduate, you get your doctorate degree, and then you have to pass a board certified exam that's 250 questions at a testing center. Okay, so that's as far as the schooling and testing. Once you get your license exam, you're ready to start working as a physical therapist in one of the different settings that we talked about. Pros and cons.
Some questions. I've been waiting for that slide. So there were some questions. You went over some of the answers, so let me just make sure. Is it really competitive to get into physical therapy school? And then as a follow-up to that, do you have to have your undergraduate degree in kinesiology, or can it be in anything, kind of like, medical school can really be in anything?
Yeah, no, those are two really good questions. So let's tackle the first one. The first one, I believe, was, is it really competitive to get into physical therapy school? So you go through college, you get your undergraduate degree, your bachelor's degree, and then trying to apply for graduate school, is it competitive? Yeah, it's pretty competitive at this point. There's a lot of programs around the nation now. So a lot of our staff that work with us who are not physical therapists are striving to become physical therapists. A lot of them have to apply about 2 times in order to get in. Now, that's directly related to how many schools you apply to as well. So if you're only applying to one school, you live in Sacramento, you want to go to Sac State is a very competitive physical therapy program. So they get, I sit on the interview board for the PT program, and we get about 600 to 800 applicants per year. You guys want to know how many students are in one cohort, in one class? 32. So you're going to get 600 to 800 applicants vying for those 32 spots. Now, I'll tell you right off the bat, if your GPA isn't at least a 3.5, even up to like a 3.8, you're probably going to be deleted from applying to a lot of these schools. Okay, they really look for people who have a high GPA. So it's very important once you get into college, and even now setting yourself up, that you have a pretty high GPA. That's one thing that they use to just eliminate a lot of applicants. So GPA usually brings down that applicant pool to about 300. Okay, so now you got 300 people vying for those 32 spots. And then from there, they cut it down to about 100 people. And those 100 people, those are the ones that get interviews. And those 100 people have a pretty good GPA. That's kind of standard. They've done a lot of observation hours. They've worked in the community. They've gone above and beyond just going to school and kind of taking classes. So you got to get out there in the community. You got to do some community outreach, whether that's volunteering at the local YMCA, working with your teachers, doing different programs that they have, getting involved in sports or something like that, little after school activities. Those look really good on applications when you're trying to apply for graduate school. It doesn't have to be now. You can do that in college too, and meet people and find out different programs that interest you. But those are some things that are going to kind of set you apart. Okay, so that was the first question. The second question was, do you need to get your undergraduate degree in kinesiology? You do not need to get your undergraduate degree in kinesiology, but kinesiology does set you up the best for the prerequisites that are needed for graduate school. So there's typically 4 or 5 prereqs that are needed. So human anatomy, biology, physiology, biomechanics, and I think human physiology as well, or psychology. There's like 4 or 5 that are needed. So if you do, let's say, a business degree, well, then you have to still take those other 5 classes. And I think 4 of those 5 classes are already in the kinesiology program. So you can definitely do another degree. But if you do another degree, you just got to make sure that you're getting chemistry, physics, anatomy, chemistry, human anatomy, physiology, biology, all those other ones in the other degree that you're getting as well. Okay.
Okay, couple other questions, and just letting you know, you've got a 10-minute warning before our next speaker comes on.
Perfect.
But does your organization hire physical therapy assistants? And is that something you would recommend these students look into as maybe a precursor to going into physical therapy?
Yeah, that's a really good question too. So we have physical therapy aides is what they're called. So physical therapy aides who we have 12 physical therapists, and we have 4 physical therapy aides. Okay. So our aides are people who are in their last year of their program in undergraduate school. So they're like right in that last year, they're about to graduate, and they're looking to apply to physical therapy programs after that. So we hire people who are kind of at the tail end of their program, or they have recently graduated and now they're waiting to apply. Maybe they didn't get in the first time, and so they're going to wait till the next year to apply, and they want to get some work experience in between. So we do hire physical therapy aides, and that does look really good on your application when you're applying for PT school, because you've already worked at a facility where physical therapy is being practiced. Okay. And hospitals do that, other facilities do that a ton. And you can also get those observation hours or volunteer too, and that also helps your application look a little bit stronger than others. Getting observation hours in different settings too, so not just a private practice like ours, but the hospital setting, nursing homes, getting a wide variety of settings for observation hours is what schools are looking for too. Okay, some pros and cons. So pros, it's a great career. You get to help people constantly. So people are coming in pain, you're helping them get out of pain. You're helping them return to the activities that they really are passionate about doing and really probably live for. It's a pretty good salary. I'd say, new PTs coming out of school right now are making anywhere between $75,000 to $85,000 per year. And that's just dependent on the different settings that you're working in. It's always in demand. So there's a huge demand for physical therapists, and that's why it's pretty competitive right now getting into school. But once you get out of school, it is very easy to find a job. I don't know any physical therapists right now that are not working. And through this whole pandemic, physical therapists fall under the healthcare. So we stayed open this entire time. So there's a lot of job security, even when a huge pandemic like COVID that just happened. So there's a couple cons. It's a lot of school. There's you have to get really good grades while you're in school. Let me see. You need to get excellent grades to attend graduate school. So if you struggle a little bit, it's definitely still doable to get into graduate school. So don't be discouraged, but you have to do pretty well in those science and math classes. And then loans, a lot of programs are pretty expensive. I know Sac State now is upwards of $90,000 to $100,000 for graduate school alone. So just know that going into this profession, like many other healthcare professions, you're probably going to have to take out a student loan at some point in order to help get you through the programs. Okay. Overall, it's an awesome career. I mean, the relationships that you make. This is myself, Kyle, Katie, who works with us, and this is the Giants team doctor, and this was one of the courses, sports med programs that we did with them. We got to go out on the field and do all that stuff. You just meet so many people. This is another athlete that she had an ACL tear, volleyball player, really good volleyball player. We rehabbed her all through her ACL recovery, and then she got back and she signed to Humboldt State to play volleyball. So these are some of the firefighters that we work with. You just meet so many people, and there's so many lives that you can affect in a positive manner that it is just a great profession to get into. And like I said, if you like people, if you like helping people and helping people return to their previous level of function and making their lives better, that's what really a physical therapist is all about. Okay. All right. Any other questions that we have? And that was like perfect timing. We got a few more minutes here for questions. So if anyone has any further questions that haven't already been answered, now's the time.
I'm looking through. Some people were messaging me directly on accident here. Let me make sure you haven't gone over them. I know that many of our staff members are texting me and saying that we need appointments for some of our challenges, because a lot of us are in weightlifting. So apparently we'd like to come and see you.
Yeah, perfect. Yep. That's funny.
Let's see. I don't see any other questions that you haven't really already answered. Oh, here's one. Why did you choose sports medicine as opposed to the other specialties in physical therapy?
Yeah, and I going back to my high school days, like where you guys are at right now, and being an athlete and getting injured, it was pretty depressing, to be honest, because I'd maybe like some of you played sports since I was like 4 years old, all the way up to being 15 when I got hurt, and it was depressing. The surgeon told me that I'll probably never play soccer again. It was a really bad injury, really bad break, tough surgery. And then going and working with a physical therapist, he said, oh, well, you should be able to get back to playing. We're going to see how this process goes. And, we can't say no right now, but let's just see how everything plays out. So right then and there, I got a lot of hope from my physical therapist that some of the other healthcare providers didn't really give me a shot. So, being an athlete, and I went through the whole process, I got back to playing, is really, really, really rewarding that I could see the physical therapist going through and rehabbing somebody and getting them back to the prior level of function that they had before. I had a passion for athletics. I went on and played sports in college. I never lost that passion for sports. And I think just with my own personal story and being an injured athlete and going through that process, I feel like I can really relate to the injured athlete. So I kind of know what they're going through, and definitely other people who are going through physical therapy in other settings, I can relate to them as well. But just me and my background and being more in athletics, that was really a big push of why I wanted to go into more sports physical therapy versus orthopedics or geriatrics or pediatrics. Out of the 34 people that were in my class, there was only 4 of us that wanted to go into sports. So it's definitely not the vast majority of physical therapists. A lot of people do want to work in the hospital. A lot of people do want to work with kids. So I would say sports is just a very small niche of physical therapy, and there's a lot of different ways that you can go. But what's good is you get your license and you can pick and choose whichever setting you want to work in.
Great. I think that's all the time we have for questions. If you had one more activity, but just wanted to let the students know that Sam can give information to contact your office, because you did mention job shadowing or observing for an hour or so for some of the high school students. So if that's okay with you, we'll share that information at a follow-up email today.
No, that's perfect. And we have 4 locations. So we have an Elk Grove facility, a Sacramento, Fair Oaks, and Rancho Murrieta. So you guys have different options as far as if you want to observe and shadow for a little bit, there's different, depending on where you're at and the ease of getting there, there's different locations.
Okay. Did you have an activity that you still wanted to do, or are we good?
I am all activitied out. I think we
All right.
touched our toes, we squatted a bunch, we looked at people moving.
Yep.
So I appreciate your guys' attention during this. I know an hour is kind of a long time to hear someone talk, but hopefully you guys got some good key points from it. And again, if you guys have any questions, like I said, Sam, probably get out my email if anyone has any other specific questions moving forward.
All right, wonderful. Students, help me thank Dan for taking time out of his really busy day to come and share all of this with you. And thank you for helping us get our blood moving and get a little bit of activity in for today. So thank you again.